A 14-year-old Japanese girl died unexpectedly 2 days after receiving the third dose of the BNT1262b2 mRNA COVID-19 vaccine on the 10th of August 2022. As per case report, despite her history of orthostatic dysregulation, she was healthy by nature and was active in her middle school athletic team. The day after vaccination, she developed a fever of 37.9 degrees Celsius, which resolved by the same evening. Her sister, who had slept with her that night, reported that she woke up briefly because she was having difficulty in breathing, talked with her sister, and went to bed soon after. The following morning, her mother noticed that she was not breathing and had a pale appearance, and she immediately called an ambulance. The patient was in cardiopulmonary arrest when the ambulance crew arrived at their house, and attempts to administer advanced life support were unsuccessful. She died 45 hours after the third vaccination. After the first dose of vaccine on September 12, 2021, she had arm pain without fever. The day after the second dose on October 3, 2021, she missed school because she had a fever of less than 38 degrees Celsius. All three vaccines were made by Pfizer. An autopsy was performed the following day to evaluate the cause of sudden death. Autopsy findings showed congestive edema of the lungs, T-cell lymphocytic and macrophage infiltration in the lungs, pericardium and myocardium of the left atria and left ventricle, liver, kidneys, stomach, duodenum, bladder, and diaphragm. Since there was no preceding infection, allergy, or drug toxicity exposure, the patient was diagnosed with post-vaccination pneumonia, myopericarditis, hepatitis, nephritis, gastroenteritis, cystitis, and myositis. Although neither type of inflammation is fatal by itself, arrhythmia is reported to be the most common cause of death in patients with atrial myopericarditis. In the present case, arrhythmia of atrial origin was assumed as the cause of cardiac failure and death. In sudden post-vaccination deaths, aggressive autopsy, systemic search, and histological examination involving extensive sectioning of the heart, including the atrium, are indispensable. I am Lovely Montoya of Manila STV.